Some of my main concerns were myself. If I did the procedure, would I be okay with it? I was also concerned about what other people would think going through the procedure, because it is plastic surgery.
You know, so many people look at plastic surgery, the whole field, as a negative, as in just a negative field. You know, why would you want to do that? Why would you want to spend the money to change anything, you know?
I think people have a false understanding of plastic surgery, and they think that if someone is going to have plastic surgery done or is interested in plastic surgery, they're an extremely vain person, that they are very consumed with themselves, and they might not understand there's other reasons behind that, you know, childhood traumas or just the way you grew up.
I was concerned about family and friends. I was concerned that they would judge me because they thought I wanted to look perfect, and that's not what I was going for. I just wanted to look better.
I get so many patients come in and tell me that they feel that they're not a vain person and that it feels unnatural for them to be here and to be coming to talk to Dr. Banis. I try to tell them that it's not a level of vanity, but it's a level of feeling better about yourself. And if you feel better about yourself, you feel better about your relationships and your life in general.
Vanity is a word I wish I could banish. We have so many people coming into this practice who are concerned with the issue of perceived vanity, and it's not really an issue with 98% of them. What they're really saying is they would like a better self-image. They'd like a better body image. But this isn't vanity. Positive self-image is something that is making many motivational speakers millions of dollars every year. And this is what this type of surgery and self-improvement is all about. It happens to be achieved by surgical methods. But I wish we could just banish the word vanity from the dictionary for purposes of this practice.
I was afraid I'd look like I had a procedure done, and I wanted to look completely natural. I didn't really want to share the information with anyone. I wanted to just look better than I already look. I wanted to have more self-confidence than I have, or had, I should say. So I just wanted to look very, very natural. I did not want to look stretched or pulled or tucked, and Dr. Banis did just that. It just made me better and made me feel better.
My husband was concerned because he had seen women that were very obviously done, that had had plastic surgery before, and it was obvious, and he didn't like that. He didn't want it to be obvious, and he wanted it to be natural, and I think he was put at ease when he came in with me for the initial consult, and he saw the size that I was going to go with, and he was comfortable with that, and now he loves them. Can't keep his hands off.
We are aware that some patients are afraid to be too big or too tight and have an operated look. Dr. Banis is very good technically and wants them to give the most natural look possible.
In fact, one of my priorities is to achieve a non-operated look for our patients. My patients are not coming in to shout, "I have had an operation." They want to look natural. They want to look rejuvenated, rested. They want to be able to wear their clothes more comfortably. They don't want to shout in any way that I've had an operation. This isn't Hollywood, and there certainly are reasons some people may want that effect, but not in our population.
To be honest, I have watched those shows, and I do see them. Dr. Banis is just way above them. Way above them. If they could come in and do a show on him, it'd be a hit. It'd be number one. What he could show them is the passion, the professionalism, and the quality of his work is just number one.
I think Dr. Banis is different because it's about making you feel better as a person, not making you look like a Barbie doll or a Playboy bunny or anything like that. I mean, he talks to you about your personal life and why do you want this certain procedure done and what results are you expecting. He doesn't want you to have unreasonable expectations. He wants you to understand the procedure, know what the results are going to be, and then make the procedure work for you so that you are more comfortable in your own skin. It's your skin and you need to be comfortable in it, and he's able to do that.
First of all, Dr. Banis wouldn't do anything that was going to look outrageous because he made that pretty clear to me. Not that I wanted to go like that, but I don't think he would do it. If it was going to look too fake or too ostentatious, I don't think he would do it. He would tell somebody they would need to find someone else. I honestly think that he's like that. Now, if it was their livelihood or something, maybe, but I don't think that he's that type of doctor. He wants people to look as natural and as good as they can.
One of the things they can always be assured of is we're not going to do anything that is going to not be in their best interests. We won't take them too far, and we won't take them anywhere if I can't be sure that they're going to have a good outcome.
One of my procedures, I've had some work done on my face, and I was terrified that I wouldn't be able to trust the doctor doing it. And but I had none of those worries with Dr. Banis or Abby. So they both have been fabulous, and they've made me feel better than I thought I ever could feel.
The concern was that the things were on my face, and I didn't want a dermatologist to mess around with a scalpel around my face. And that's when my husband said, you need to see a plastic surgeon. And when we came to see Dr. Banis, he was totally made me feel at ease. He said, oh, you'll never even see the scar. You'll never know that there was anything there when I'm done. And you can't see anything, can you?
I had a lot of friends and family members who said, oh, why are you going through this huge surgery that's taking 13, 15 hours to reconstruct? Why don't you just do this? Why don't you do that, something simpler? And they were fearful for me making it through that big of a surgery. And it was a huge surgery, but I had so much confidence that Dr. Banis knew exactly what he was doing, that he was going to do a beautiful job, and he would do whatever it took to make it work correctly, to make it work right. And he didn't cut corners. He did exactly what he needed to do to give me the best results that he could give me.
Safety is the most important thing in this practice. Cosmetic or aesthetic procedures are by definition not necessary. They're not life-saving, they're not function-saving. They're certainly psychologically important, but safety is absolutely paramount to do these things. I personally couldn't continue doing a elective cosmetic practice if I were having any significant issue with safety. So we assess every patient for their overall physical health and well-being, and then we do things with the highest safety standards. We do things with the assistance of anesthetists whenever there's major anesthesia to be administered, so that I don't have to be thinking about the anesthesia, and I have a separate professional monitoring the patient's vital signs and the well-being of the patient under anesthesia. All I have to think about is doing the procedure technically to the best of my ability.